Good morning, welcome to EduSet Network. Friend, today we are going to discuss therapeutic nutrition. In the last lecture, we saw the introductory part of therapeutic nutrition. Today, we will discuss with a special reference to diabetes, hypertension, and other cases. And for discussion on this very topic, we have in the studio the same resource person, Dr. Nilma Asthana. She teaches home science in Delhi University. She is assistant professor of home science education in Lady Irwin College, University of Delhi. So, I think her knowledge and experience will help us to understand this topic. So, on your behalf, I welcome for the EduSet lecture on the topic therapeutic nutrition. Welcome.
Thank you, sir. So, today I will start with my previous, in continuation of my previous lecture, that was on therapeutic nutrition. Yesterday I was discussing about the conditions which are required to be altered to modify the diet to make it more relevant for a particular disease. So, we discussed three issues like control of nutrients or change in consistency or calorie intake. So, three conditions were discussed and two more are there. So, I will discuss, I will start my lecture with the fourth condition, that is food allergies and food intolerance. In few cases, we need to check the food items which are being served to the individual. A few individuals are allergic to certain food items, for example, milk. The lactose present in milk sometimes give irritation to the body and sometimes make changes the condition of the body. So, food allergies and food intolerance. Specific foods may cause immunologically mediated response in certain individuals. They are immune to certain food items and their body does not accept those food items. So, they in a way resist those food items, and in the process of resistance certain conditions are developed in the bodies which give them discomfort, or sometimes it it becomes very much dangerous also to the life. So, those foods which cause a known reaction are eliminated from the diet. Common food allergens are milk, egg, soy, peanuts, wheat and many other foods. So, basically the food items which are allergic to patients are to individuals are milk, egg, soy, peanuts, wheat and many few other things. And you will surprised to know that if the child is allergic to milk and infant is continuously given the milk, whether mother's milk or other cow's milk, he will not his body or her body will not accept that milk, and in the reaction, a very serious reaction could be shown by the child. So, it is very difficult to understand the cause of the reaction sometimes. So, these days it is very much popular and very much actually an urgent need to understand which kind of which type of allergy a person has from which food product. So, the most common food intolerance is lactose, that is milk sugar. Intolerance, foods with milk are eliminated from the diets. In this case, completely the child is not given the milk and the lactose carbohydrate, and those food items are avoided in which lactose is present. So, milk and milk products are totally avoided in this case. Food with milk are another example is gluten intolerance. As you all know that gluten is present in the wheat and wheat products are eliminated from the diet. Such diets are called gluten free diet, and this type of allergy is very much frequent and very much common these days amongst the children. And you will surprised to know, and you will it is quite difficult to understand that how you will avoid chapati or bread completely from the child's diet. It is really impossible, but if the allergy is there, it is an urgent need or emergent need to eliminate wheat completely from the diet. and in that case chapati and breads are even the cakes etc. are supplemented by some other things like products which are made up of corn or soya or anything which is wheat free and gluten free. Gluten is the substance which gives a kind of elasticity to the wheat flour. The next condition which is kept in mind while planning a therapeutic diet is modifications in frequency. Sometimes we cannot give food, good quantity food at a time to the patients because they are not able to eat and able to digest that much food at a time. So, it becomes necessary to give small meal, small portion of meals at frequent intervals. So, smaller frequent meals are suggested when the patients are recovering. For example, when the patient is recovering from fever or diarrhea or some surgery or some serious disease or some accident, small frequent meals are given to the patient so that it could not harm the digestive system of the patient, it should not harm the gastrointestinal tract of the patient, and in some disease conditions the patient is not be able to eat very large amount of food as I told you earlier. Therefore, it is essential to give smaller meals at frequent intervals as in fever, diarrhea, ulcer etc. For example, in ulcer the intestinal tract is affected and it becomes very much painful for the intestinal tract if a large amount of food is given at a time. So, it is kept in mind and it is very much important to keep this factor in mind that smaller amount of meal should be given at frequent interval and that meal should not be having fiber. So, there are so many other aspects which are taken care of while planning a therapeutic diet. So, now I can say that the 5 points are too important to understand the manner in which a diet is planned for a patient. So, like consistency, soft or liquid or semi-solid diet is to be given to the patient according to the condition, then nutrient, which nutrient is required, which nutrient is to be restricted. For example, in diabetes sugar, carbohydrate is restricted and in hypertension salt is restricted. So, we have to keep in mind the type of nutrients which has to be restricted or which has to be given in extra. For example, in undernutrition or underweight condition, extra amount of calorie and protein is given to the patient. Then the energy intake, sometimes in the case of certain conditions energy is restricted. For example, in obesity energy is restricted to avoid certain other metabological conditions to be right. So, and these two like the diet which should be avoided in certain cases and the modification in frequency. By keeping these 5 factors in mind, we will further discuss the special conditions. So, in today's lecture I will discuss 5 special conditions and these conditions are fever, underweight, diarrhea, hypertension or cardiovascular conditions and diabetes. So, diet modification in certain conditions, first is fever. As we all know that in common terms fever is increase in the body temperature. We all know that each and every person who is not feeling well, having some uncomfort, feeling some uncomfort, so he or she may say that he is having fever and body is not normal. So, an increase in the body temperature above normal is generally referred to as fever. It may occur in response to infection, inflammation or unknown causes. So, fever does not occur as it is. There could be is certainly certain conditions which are initiating the rise in temperature. For example, if child hurts or has some cut or some wound. So, infection due to the infected wound or infected cut, the body temperature increases. In the same way, inflammation also causes fever. In some other cases, some internal disturbances also causes fever. So, there are two factors, two agents, exogenous agents and endogenous agents. Exogenous agents are bacteria or fungi, they develop infection, and endogenous factors are antigen antibody reactions, malignancy or graft rejection. So, exogenous means the factors which are from outside, and endogenous factors which are from inside. So, sometimes the exogenous factor like bacteria or fungi infect our body and cause the rise in temperature. Endogenous factor, that is antigen antibody reactions, some disturbance in the immune system of the body, it may cause the fever in the body. Basically, the infection from outside is responsible for the rise in temperature. For example, in the case of typhoid or jaundice or flu, viral infections, or cold and cough. Cold and cough is again a viral infection. So, these infections cause fever. In severe conditions also, like if the patient is undergoing some surgery or some serious disease like cancer, and it gives us a good indication that if there is fever, there must be certain infection and it should be treated properly. Therefore, doctor suggests us so many tests to know the cause of the fever. For example, urine infection or urine test, blood test of different types, urine test of different types, and the doctors arrive to a solution, or they can take a decision that what is the root cause of the fever. On the basis of the duration of fever, it is divided into two types, short fever and long fever. Short as in acute fevers of colds, tonsillitis, influenza and so on. Chronic fever as in long standing tuberculosis, or it may be intermittent as in case of malaria. These days dengue is also very much common. So, there are variety of infections and variety of different types of fever and are called from different names. So, maybe most commonly we say that tonsillitis, influenza, viral fever, these are short term fevers, and long term fever could be tuberculosis, typhoid, malaria, etc. The metabolism in fever, actually it disturbs the metabolism of the body. Metabolic rate increases by 13% for every degree Celsius rise in body temperature. For example, if fever is 100 degree, then the metabolism will rise, in rate of metabolism will rise beyond 40%. Restlessness also increases, hence increase in caloric requirement. So, if fever is very high, it is obvious that the patient should be given extra amount of calorie to fulfill the caloric requirement of the patient, and high doses of juices and electrolytes should be given to the patient. It also causes decreased glycogen stores and decreased store of adipose tissues. As I said that caloric requirement is increased, and when the patient is fulfilling his or her caloric requirement without any food, then obviously the glycogen store is being utilized to provide calorie to the patient. Therefore, in a way the fat which is deposited in the adipose tissue in the form of glycogen will be utilized. So, it may cause decrease in the glycogen stores and decrease in the store of adipose tissue. Then increased catabolism of proteins especially in the typhoid fever, malaria, typhus fever, poliomyelitis and others. Increased nitrogen waste place additional burden on kidneys. So, as in long term fevers like typhoid, malaria, typhus or poliomyelitis, protein is catabolism of protein is increased and it causes increased nitrogenous waste, and this increased nitrogenous waste create a burden on the kidneys, and kidneys have to work more to treat these nitrogen wastes, and in a way if it persists, it definitely affects the kidneys of the body. Then accelerated loss of body water owing to perspiration and the excretion of body wastes. Large amount of fluid is wasted in the case of high fevers because of the because of perspiration and excretion of the body waste from the urine. So, it is important to replace that much water, and in the diseased conditions patients do not like to have more and more water, and when they do not take orally, then it is given through intravenous. When perspiration is there and loss is due to excretion, then increased excretion of sodium and potassium take place. So, it disturbs the electrolyte balance of the body, and in that case it is very much important to give appropriate or balanced amount of sodium and potassium to the body, and it may be given orally, and if the patient is not able to take these orally, it should be definitely given through intravenous. Now, general dietary considerations during fever. As we come to know that large amount of calorie is utilized by the body due to fever and due to increase in temperature, it is quite obvious that the caloric requirement is increased in the fever. It depends on nature and severity of pathological conditions and the length of the convalescence, that is period of recovery. So, which type of fever, whether long duration fever or short duration fever or very high temperature fever, when the temperature is touching around 104, 103 degrees Celsius Fahrenheit daily. So, it gives an indication that which kind of diet should be given to the patient, and as we discussed, five different types of conditions or factors to be kept in mind while giving the diet. So, naturally we should give the patient liquid diet, as well as diet should be given on frequent intervals. The caloric requirement should be increased to a greater extent, as well as the electrolyte balance should be maintained by giving these minerals orally or through intravenous. So, in general it should meet the following requirements. Energy may be increased up to 50% if the temperature is high and tissue destruction is great, as in the case of high grade fever, and in the case of some long duration fever when continuously the patient is suffering from high fever for more than 7 to 10 days. So, in that case cells and tissues are destructed a lot, and these need to be constructed, and for the construction of cells and tissues, it is important to give high protein, high calorie diet, and restlessness also increases energy requirement. Protein about 100 gram or more is prescribed for adult when fever is prolonged. It is for adults and for children. About 100 gram or more is prescribed for adult when fever is prolonged. It is more easily utilized when calorie intake is liberal. So, we should keep in mind that protein requirement should be liberal, calorie requirement should be liberal if we want that the patient should utilize the protein fully. High protein beverages may be used as supplements to regular meals. High protein beverages means where the quality of protein is high, all the essential amino acids are present in the protein. In that case, we can give non-vegetarian soups to the patients, milk in some form, milk maybe not very thick, it should be could be diluted, but high protein beverages must be given to the patient as supplements to regular meals. Then very important is carbohydrates. As we came to know that glycogen which is deposited in the tissues in the deposed tissues, these tissues are restricted in the fever, and glycogen stores are is destroyed during fever. It should be replenished by liberal intake of carbohydrates. Any sugar such as glucose, corn syrup and cane sugar may be given, and glucose, you all know that whenever there is illness, we give glucose in glucose powder in water, and it is given because it is readily absorbed in the blood and give energy immediately. So, glucose, as it is less sweet, may be given in good amount and is absorbed easily into the bloodstream, being the simple sugar without the necessity for enzyme action. So, we all know about the digestion of glucose. It is absorbed easily by the intestines, by the blood, and can give energy to the patient immediately. So, all of you would have seen that in the case of high fever or acute fever, we give continuously the electrol powder or glucose powder to the patient to supplement the to increase the glucose level and to give the patient required energy. Lactose in some cases may increase fermentation in small intestine, resulting in diarrhea. Lactose which is present in the milk may cause fermentation in small intestine, and it results in diarrhea. So, it may be avoided during fever. Now, the fats may be rapidly increased due to judicious use of fat. Fried foods and rich pastries may retard digestion unduly. As caloric requirement is increased and fat is a good source of calorie and rich source of calorie, we can give fat, but fried food and rich pastries must be avoided because they may disturb the digestion, and therefore, whenever we use fat, it should be very much judicious and appropriate. We should not feel that a patient requires a lot of energy, so we should give lot of fat, and that should not happen. The next is minerals. As I discussed that sodium and potassium, they both are destroyed by the excretion due to perspiration and excretion in other forms. So, sufficient intake of sodium chloride, use of salty broth and soups is advisable. Sodium chloride is common salt. Potassium is generally present in foods, but limited intake of food might result in potassium depletion. So, we just do not give additional potassium in any form because it is generally present in food products. But when we see that patient is not taking food, is not able to take food, and it is being wasted through sweat and urine, so it is required to give additional protein in this case. Otherwise, it may result in the potassium depletion, and which is not good because it is important to maintain electrolyte balance in the body. Fruit juices and milk are relatively good sources of potassium and could be given in good quantity, but again we need to see that if lactose is irritating the digestion, we can decrease the quantity of milk. Then vitamins. Increased requirement of vitamin A and ascorbic acid. Why vitamin A and ascorbic acid? Because as we know that certain nutrients are required for the proper calorie protein intake, and for that vitamin A and ascorbic acid, though they are not directly related to that, but as they are being cells are being destroyed and high energy requirement is there. So, in that case vitamin A and ascorbic acid requirement is also increased. Vitamin B complex are needed at increased level proportionate to the increase of calories. We all know because vitamin B complex requirement is directly related to the caloric requirement of the individual, and if we say that caloric requirement is too much high during fever, so accordingly vitamin B complex should be increased in the diet. 0.5 milligram thiamine is required, is equivalent per 1000 additional kilocalorie. 0.6 milligram riboflavin is equivalent to 1000 additional kilocalories, and 6.6 milligram niacin is equivalent to 1000 kilocalories. So, accordingly we should increase the amount of these vitamins, and as we know that caloric requirement is directly related to the rise in the degree of the temperature, accordingly we should increase the intake of vitamin B complex in our diet. Oral therapy with antibiotic drugs interferes with synthesis of some vitamin B complex by intestinal bacteria, thus necessitating a prescription for vitamin supplements for a very short time. As antibiotic drugs, we all know that we feel very much irritated when we take antibiotic medicines, and these antibiotic medicines actually interferes with the digestion of the body, and digestion of the body because they interferes with the synthesis of vitamin B complex, and for that it is important to give required or necessary vitamin B complex orally, so that proper digestion should take place in the body and intestinal health should be maintained for further further digestion. It is a cycle. If digestion is faulty, then absorption will be faulty, and it will become a cyclic condition where the condition after fever will not be very good for so many long days, for so many days. So, therefore, it is important to give proper vitamin B complex in right amount orally during fever when antibiotic medicines are given to the patients. In fever, fluid intake is obviously increased to a large level. Intake must be liberal to compensate for the losses from the skin and to permit adequate volume of urine for excreting the waste. Sometimes when patient do not take water, urine feels difficulty in passing the urine, and if it is difficulty in passing the urine, the waste will not be excreted and it will create further problem to the body. So, it is important to give right amount of fluid, good amount of fluid, liberal amount of fluid to the patient for proper excretion of wastes. 2500 to 5000 milliliter daily is necessary, which may include water, beverages, soup, fruits, fruit juices, etc. It depends on the condition of the patient, how much the patient could digest. So, appropriate type of beverages should be given, very light, no pungent smell, no spices. So, it should be kept in mind that very simple, plain and bland beverages, soups, fruit juices should be given to the patient along with good amount of water. Now, the diet in diet, while planning diet, we should plan small amount of food, and it should be given at frequent intervals every 2 hours for first 2-3 days, which can be gradually increased to 4 hours. Include foods which are soft, bland, easily digested and absorbed. Frequent, easily digested and absorbed, in that case we should avoid fibers, we should avoid spices, condiments, and if we are avoiding fibers, so fibrous fruits and vegetables must be avoided. Frequent small food helpings are essential because of low appetite, poor digestion and absorption. As the fever improves, the size of the helping can be increased. So, the diet should be planned according to the type of fever. If short duration period, then we can restrict the diet for 1 or 2 days, and in that case there will be not much loss of nutrients. But if the fever is for a very long duration, the diet should be well balanced in terms of the availability of the nutrients, because in long term fever, as the patient is not taking diet properly, the planning of the diet is very important, and right kind of amount, right kind of nutrient which is to be given, which type of diet, consistency of the diet, caloric requirement of the patient, everything should be kept in mind and should be planned properly. And 6 to 8 serving, I think, will be appropriate for the patient who are suffering from fever, whether long term or short term. The next condition is diarrhea. Diarrhea is the frequent passing of loose, watery and unformed stools which may also contain blood or mucus. It occurs due to an abnormally rapid passage of food preventing complete digestion and absorption. Diarrhea is a symptom of underlying functional or organic disease and is acute or chronic in nature. So, diarrhea you cannot say is a disease, it could be a condition, it could be a symptom. In some diseases, diarrhea may indicate the onset of the of that particular disease. So, sometimes it also contain blood and mucus. When it irritates the intestine, it also contains mucus. Sometimes it occurs due to an abnormally rapid passage of food, and in that case food is totally not digested and absorbed, and it may be due to severe infection in gastrointestinal function. So, diarrhea is a symptom of underlying function of or organic disease and is acute or chronic in nature. Sometimes it is very much acute for a day or two, sometimes it becomes a chronic condition in which it can go on for days. Acute diarrhea is characterized by the sudden onset of frequent stools of watery consistency, abdominal pain, cramping, weakness and sometimes fever and vomiting. As we come to know about fever, fever is occurred due to some infection. So, diarrhea is due to infection and it may cause fever also. So, frequent stools, abdominal pain, cramp, and as it flushes out maximum nutrients, maximum food without digestion and absorption, it gives a kind of weakness to the patient. Sometimes it is also associated with vomiting. Since the duration is 24 to 48 hours, nutritional losses are not a prime concern. The prime concern is how to prevent, how to stop this condition in which patient is continuously losing good amount of nutrition without absorbing and becoming weak very fast. Chronic diarrhea persists for 2 weeks or longer. Nutritional deficiencies develop due to the rapid passage of intestinal contents does not allow sufficient time for absorption. Naturally, if the diarrhea continues for 2 weeks or more, nutritional deficiency will develop and it will make the person very weak. And diarrhea or fever, these two conditions become are connected, and diarrhea as it creates nutritional deficiency, it may create certain other deficiency or develop other deficiency diseases. For example, if nutrients are not being absorbed by the intestine or digested properly, then vitamin B deficiencies will be there. All the water soluble vitamins will be discarded from the body and may develop a kind of deficiency of these vitamins. Along with this, protein calorie malnutrition will also be there, and it becomes a cyclic process. When diarrhea is there, nutritional deficiencies are there, and it will create further it will worsen the situation further. Nutritional considerations during diarrhea. Fluids losses should be replaced by a liberal intake to prevent dehydration, especially in susceptible age groups, that is children and elderly. Parenteral fluids are often administered, so fluids are very much important, and losses should be replaced continuously, and it is said that children should be given continuously the ORS solution, that is oral rehydration solution. In children, this condition is more frequent, and diarrhea creates calorie protein malnutrition also. So, it is important for the caregiver to give continuously the liquid, and that also to maintain the electrolyte balance of the body. And prenatal fluids are often when the child is or the individual is not able to drink or take orally, he or she is continuously vomiting, then it is important to give fluid through intravenous. So, parenteral fluids are often administered and becomes important when it is not possible for the patient to digest the liquid orally. Now, electrolytes, losses of the sodium, potassium and other electrolytes account for the profound weakness associated with severe diarrhea, and anorexia, vomiting, listlessness and muscle weakness may occur until losses are replaced by a liberal intake of fluid such as fruit juices that are high in potassium, because potassium is required for the proper functioning of the body muscles. Now, nutrient malabsorption. There are so many nutrients which are not being absorbed during diarrhea. So, long continued diarrhea may result in depletion of tissues protein and decreased serum protein levels. Fat losses are considerable with consequent loss of calories and fat soluble vitamins. Calorie intake must be as high as 3000 calorie with 100 to 150 gram protein, 100 to 120 gram of fat, and the remainder as carbohydrate. So, it is very much obvious and simple to understand that when patient is not taking properly any diet and is losing nutrients through stool, it becomes important for the patient to get these nutrients otherwise, and protein is depleted and decreased, and it may cause decreased serum protein level. Fat losses are also considerable because calories are continuously being lost, and fat soluble vitamins, as I told you earlier, are not being absorbed through the intestine. Therefore, calories should be increased to 3000 kilocalorie. 100 to 150 gram of protein is must, and 100 to 120 gram of fat is must, and the remaining energy should be given through carbohydrate. Nutritional, again it is the other nutrients like vitamin B complex are being destroyed due to, as these are water soluble, and intake is less. Temporary reduction in synthesis of vitamin B complex due to antibiotics, because antibiotics are being given in diarrhea. The vitamin B complex are not being synthesized in the body. So, orally it should be given. Vitamin B12, folic acid and niacin deficiencies have been observed in various diarrheas when it is long duration diarrhea. Iron deficiency is also prominent due to increased losses of iron in the feces, occasional blood losses and reduced intake of iron rich foods. Sometimes diarrhea is associated with blood stools also. So, in that case iron is lost a lot, and as the patient is not able to take iron orally, the deficiency of iron occurs in diarrhea also. So, when you find a child who is protein calorie malnourished, you will definitely find the child is also suffering from diarrhea as well as the child is anemic, because all these factors are closely interrelated and worsen the situation. Patients show remarkable improvement when given supplement iron therapy. So, when iron is given orally, the other actions and metabolism also get help through this iron. Now, diet in diarrheal states. Small amount of food should be given to patient at regular intervals. In the beginning, food should be served at an interval of 1.5 or to 2 hours. The patient should drink plenty of fluids and eat at frequent intervals. May not be able to eat very large meals at one time due to the loss of appetite and poor digestion. Thus, 6 to 8 small meals should be given in a day. Eating several small meals a day instead of 3 large ones can help the patient feel bloated. And when this is the condition with the child should be given the oral rehydration solution every 15 minutes or every 20 minutes, so that the fluid balance should be maintained in the body, otherwise it worsens the situation. So, small meals, liquid diet, clear liquid diet, these 2-3 conditions must be kept related to diet, must be kept in mind while treating diarrhea through diet. The next condition is underweight. It is, you can see that fever, diarrhea, underweight, these all are interrelated. When there is malnourishment, diarrhea is there and the child is automatically underweight, child is or any individual is underweight. In the underdeveloped country or undeveloped countries, underweight is a common problem, most often associated with poverty, poor living conditions or long-term disease. Also occurs in people who are very active, tense and nervous and take too little rest. So, this is the condition you can, it is associated with poverty as well as with the stress, tension, hectic lifestyle, etc., when you are not taking proper nutrition. However, in some people underweight is because of a physiological difficulty in gaining and maintaining weight. Sometimes the body metabolism or immunity system or certain other internal activity of the body become the cause of underweight. So, it is the failure to ingest sufficient calories to meet the energy requirements. Due to irregular eating habits and poor selection of foods, underweight becomes the problem. Occurs in some pathological conditions such as fevers where appetite is poor. Some patients with mental illness reject food to such an extent that severe weight loss results, and it is sometimes irreversible. The condition is referred as anorexia nervosa, and in some cases the adolescent girls especially, they try to maintain their weight, they just do not eat anything and they just become mentally ill, keeping in mind always or keep thinking about their weight, and they just do not eat anything, and the condition they just lost a lot of weight and the condition is referred as anorexia nervosa. Modification of the diet in underweight. Before the weight gain is effected, the direct cause of inadequate calorie intake must be sought. These causes must be removed and high calorie diet is provided. We should not start high calorie diet as it is, because sometimes high calorie diet may be very much may affect adversely also, because in some cases the weight reduction is not due to the poverty or poor diet, it may be due to tension or stress or something else. So, we must identify the cause in the beginning before starting the diet therapy. Energy approximately 500 kilocalorie in excess of the daily needs will result in a weekly gain of about 0.5 kg. Somewhat higher level is required when fever is high or gastrointestinal disturbances are interfering with absorption or metabolism is greatly increased. So, 500 kilocalorie is given if then 0.5 kg body weight will be, body will gain 0.5 kg of weight in a week. Somewhat higher level is required when fever is very high. When fever is also there, diarrhea is also there, then high caloric requirement is there. Protein, because protein, basic function of protein is bodybuilding, so it should be, the intake should be increased. Daily intake of 100 gram or more is desirable to replace body protein and body fat. Minerals and vitamins, due to quality diet used for weight reduction, considerable deficiency of vitamin and mineral occurs. High calorie diet will provide liberal values of these nutrients. Diet in underweight condition, as it is difficult to adjust at once to a higher energy intake, it is better to begin with normal intake and gradually increase the food quantitatively and qualitatively. Small frequent feeding at regular intervals throughout a day help to increase the food intake in some individuals, while other better tolerate a 3-meal plan. So, underweight condition, we should not give too much of calories in the beginning. We should increase the level gradually according to acceptability of the patient. Very important condition is cardiovascular disease. Cardiovascular, as the name suggests, it is related to heart as well as vascular system. It includes the disease of heart and blood vessels leading to coronary heart disease and hypertension. It affects the people of all ages, but most frequent in those of middle age and most often caused by atherosclerosis. Atherosclerosis, as you all know, is the condition when cholesterol is deposited in the on the wall of the arteries and leaves less space for the blood to flow properly. And heart disease may be acute with no prior warning, as in coronary occlusion, or chronic with progressively decreasing ability to maintain the circulation. Nowadays, you must be, you will come to know about so many different kind of medical terms like using of stents or increasing of the artery, size of the artery. So, most of the people in the middle ages are suffering from some kind of heart disease, maybe hypertension, atherosclerosis or coronary heart disease, etc. So, it is important to understand the dietary aspect for this condition. The objectives of managing diet are 4, and if we keep in mind these 4 objectives, we can keep our heart healthy. It is to be understood that maximum rest for the heart is required. When we talk about maximum rest for the heart, so that we should plan our diet in such a way that the heart is not being pressed or getting stressed, because certain nutrients are directly responsible for the worsening of the condition. Prevention, the second objective is prevention or elimination of edema, means water retention in the body. Then maintenance of good nutrition is very much important. Fourth objective is acceptability of the program by the patient, and it is very important. We plan the diet, but it is for the patient to know about the importance of the diet. Modification of the diet includes first and foremost energy. Loss of weight by obese leads to considerable reduction in the work of heart. So, it helps the heart to feel relaxed when we lose weight. So, obesity is the major cause of cardiovascular disease. Second is slowing of heart rate, drop in blood pressure, and thereby cardiac efficiency is improved. 1000 to 1200 kilocalorie diet is suitable to an obese patient in bed. If the patient is bedridden, then very less amount of calories should be given. If weight is at desirable level, calories could be maintained during recovery and their return to activity. 1600 to 2000 kilocalories could be given. Nutritive adequacy, normal allowance of protein, minerals and vitamins are recommended. The proportion and kind of fat and carbohydrate may be modified so that polyunsaturated fatty acids and or complex carbohydrates predominate. Means the carbohydrate which are complex in nature and fats which are rich in polyunsaturated fatty acids should predominate the diet. In salt restriction, another source of iodine should be prescribed, especially for pregnant women and children, as we restrict the salt of a patient who is suffering from cardiovascular disease. But as salt contains iodine, it is important to prescribe another source of iodine, especially for pregnant ladies and children. Severe restriction of sodium also restricts vitamin A, because carrots and some green leafy vegetables that are high in sodium needed to be avoided. So, we should try to find other source of vitamin A as well. Sodium restricted diet, when there is retention of fluid and sodium, usually 1600 to 2300 milligram is satisfactory. Restriction of fluid is not required as long as sodium is restricted. Diet for heart patient, keep track of the number of servings you eat. Heart patient should follow regular meal timings. It helps in controlling blood sugar, burn fat more efficiently and regulate cholesterol level. Any one meal should not be too heavy and some amount of rest after every meal is advisable. The meal served should be small, given at frequent interval. This will provide sufficient nutrition without causing undue strain or pressure on the heart. Now, the last condition is diabetes mellitus, when sugar level is increased in simple terms in the body. Diabetes has been defined as a genetically and clinically heterogeneous group of disorders, all of which show glucose intolerance. It is characterized by partial or total lack of functioning of insulin and alterations in carbohydrate, proteins, fats and metabolism. So, it is important to understand energy should be controlled. Calorie allowance is same as normal individual, but should be obtained not from the sugar, and 30% to 40% of diabetic do not need insulin if their diets are controlled. Protein level could be maintained, and 12 to 20% calories should be obtained from protein. Carbohydrate, as I told you, must be avoided through sweet food products. Insulin needs are more closely correlated with total calorie intake than with the carbohydrate intake in the diet. Fat should be restricted because it is also given protein. And as calorie is not coming from carbohydrate, diabetic patient should get 30 to 35% of calorie from the fat. This could be given through skimmed milk, low fat meat, etc. Fiber, diet providing 20 gram or more of plant fiber have been associated with reduction of cholesterol. So, fat should be there in the diet, and diet plays an important role in treatment of diabetes. Small portion of meal should be given at regular interval. Important to never skip a meal. Easier to keep blood sugar stable if meals are eaten at the same time every day. Eating in large quantities should be avoided, as these can raise the blood sugar levels. Thanks a lot.
Okay. So many things, so many nutrients. So, if somebody takes meal, what essential, what will you suggest? Simple
Actually,
manner, because
in simple manner, it should be taken at the right time,
Okay.
regular intervals, not high in energy, means we should avoid fats
and
carbohydrates, but naturally our base diet is carbohydrate based, so it should be there, but in the balanced form. As I discussed in my first lecture, the recommended dietary allowances must be kept in mind while
Okay.
planning meals.
Okay, so well friends, with this word we conclude the lecture. I thank all of you for watching the lecture. On your behalf, I thank Dr. Nilma Asthana for giving such a wonderful lecture. Thank you very much.